Hi, Dr. Yass here. I wanted to try to discuss the issue which has suddenly come to the forefront during this election cycle, which is the collapse of Obamacare and the fact that premiums are skyrocketing, that in fact there are fewer insurance companies insuring people, there are fewer physicians and hospitals that are available for treatment, and the general premise proposed both by politicians and economists is that the problem lies in the ability to pay for the services for healthcare, that in fact there just hasn't become the right mechanism to bring in the revenues needed to pay for all the services being provided. And I want people to stop, pause, and think about this premise, that the reason that there is this collapse in Obamacare has nothing to do with the ability to bring in money to pay the premiums. That's not where the issue lies. The premiums are rising basically uninhibited. And the reason for that is that costs have skyrocketed. So if we were to try to look at what area of medicine has had the greatest rise in costs, there is absolutely no question. It is unequivocal that the issue of treating chronic pain is where the rise has occurred astronomically. In fact, it has increased over 1,000% over a 10-year period. So in 2002, the cost of treating chronic pain was $70 billion. 70 billion. In 2011, it was estimated to be 635 billion. Now, the overall healthcare cost to the economy is 2.2 trillion. So if we look at 635 billion, we are saying that more than one out of every $4 being spent on healthcare is going to the cost and treatment of chronic pain. You then have to look at the idea of, well, why? Why has there been this meteoric rise? And the simple answer is that before the MRI, the issue of chronic pain was really not addressed by the medical establishment. Quite simply, if someone had a fractured bone that was identified on an x-ray, it would be treated. But generally, the answer was just try to rest, try to hang on and survive, and eventually your pain would resolve. And that was all it was. Then came the MRI, and as a result of finding structural variations in the same area where people were having pain, the natural inclination was to believe that structural variations such as herniated discs, stenosis, arthritis, meniscal tears, rotator cuff tears, all these things being found on MRIs were the cause of pain. The fact is that that is completely invalid. I want you to recognize that this is the greatest fallacy ever perpetuated to the human race in the area of healthcare. The MRI does not find structural variations that are eliciting pain. In fact, these structural variations were there before the pain and will be there long after the pain. They are a completely independent variable. You know this because the study showed of those people over the age of 60, 90% of these people with no back pain, 90% of people with no back pain have bulging or degenerative discs. So clearly there is no correlation. It's a fallacy. Now, let's look at some statistics. We have 35 to 45 million MRIs performed each year, with easily 90 to 95% of them being related to identifying the cause of pain. If in fact the cause is muscular, which the Yass method has proven in more than 95 to 98% of cases, that means that more than 90% of people are being misdiagnosed. And a structural variation is identified, that becomes the tissue to be treated. Now, that means that the majority of surgeries, hundreds of billions of dollars being spent on surgeries, are invalid. The invalid nature of the surgeries have left people to suffer with chronic pain, and that led to the epidural epidemic rise in the use of prescription pain medication. Well, that got to the point where it was so out of control that the government stepped in and simply said, well, we're just not going to allow you to have pain medication to that level anymore. They did nothing to address the cause of the pain, thereby trying to resolve the cause, which would stop the need. They simply said, we won't allow you to have it anymore. Look at what's happened more recently. All of a sudden, because there's now no pain medication available to people, now the premise of doing radiofrequency ablation, which is cauterizing or burning nerves, or rhizotomy, has gone into fashion. So now massive numbers of people are having their nerves either burned or severed. This again would have nothing to do with the ability to address the potential cause of the symptom, the tissue eliciting the symptom, which in 95 to 98% of cases is muscle. So that's why you see the trend line for the cost of treating pain after being identified in 2011 being $635 billion, it's still rising and will continue to rise. So if you want to try to look at what has led to the collapse of Obamacare, it is not the fact that there's some difficulty in developing enough revenue to pay the premiums. It's the fact that costs have skyrocketed specifically over 1,000% in the issue of treating pain, and the area of treating chronic pain has now become a medical bubble. It is so invalid, and yet there's no way of taking it back. No one's going to stop using MRIs when it has led to so much money to be made. Even though the evidence is overwhelming, just think about it as an individual. Do you remember 10 to 15 years ago how many people got hip or knee replacements? Virtually nobody at the time, and yet everybody now seems to require a hip or knee replacement. Back surgeries went rampant, so much so with the failure of it that they now created, the medical establishment created the premise of the term failed back surgery syndrome as a diagnosis for those people who have the same, if not greater, pain after their surgery. You have to wake up and recognize that the system is broken. And I don't care how you try to slice it, it's never going to be about how do you create enough revenue. The answer has to be that you have to stop costs from being developed, which are completely invalid in the premise of the use of these procedures. The MRI is valid in identifying the cause of pain, the actual tissue eliciting the symptom. Therefore, all treatments associated with the MRI and the identification of structural variations is invalid. Think about it. 2002, $70 billion. 2011, $635 billion. It's probably up to over $700 to $800 billion right now. The cost of treating cardiovascular care is only $400 billion a year. So it's approaching double the cost of treating cardiovascular care. If you want to have a healthcare system, you need to recognize that the Yass method, which is the only method with a theoretical basis as to why people are suffering from chronic pain, which is the fact that you work against a gravitational force and muscles must apply force to allow function to occur. If the muscles aren't strong enough, they elicit pain, or they cause another muscle to compensate and elicit pain, or they cause the joint surfaces of the joints they attach to become misaligned, and that leads to joint pain. So therefore, only targeted strength training is the mechanism that can resolve pain. The Yass method has been utilized for over 2 decades. Thousands of people with a 95 to 98% success rate I have treated, and the Yass method has been proven to stop thousands of surgeries that were scheduled based on false diagnostic principles indicating structural variations as the cause of symptoms. And then on the other side of that, the flip side, has resolved the pain of thousands of others who had surgery based on these false diagnoses of structural variations, did nothing to resolve the pain. If anything, they had increased pain. Then the person found the Yass method. It was found to be muscular as the cause, did targeted strength training, and that resolved the pain. If you want to take back your healthcare system, everybody must become a participant. Everyone must become an advocate. Everybody has to reach out to the medical establishment, say, we will not accept the system as it is anymore. We only want to utilize the Yass method as the global primary mechanism to diagnose and treat pain. And we need to end the splintered system of having specialists who are not in a position to identify all potential causes and allow a unified method to evolve around the Yass method and allow the right tissues to be identified, thereby resolving the cause of symptoms, ending the need for the body to elicit a pain signal, and therefore ending chronic pain, leading to full functional capacity. If you want to get more information, go to my website at www.mitchellyass.com, or you can email me at drmitch@mitchellyass.com. That's drmitch at mitchellyass.com. Or you can call me on my cell phone. I'm here to answer questions. If you're confused as to why you've been treated and you're not getting any better, the answer is, in more than 90% of cases, you have been misdiagnosed. And all that's happening, our costs are skyrocketing. A lot of people are getting very wealthy. And my concern is that it's for no valid reason, and that is just a disgrace. We need to take the system back. If you want to take it upon yourself and get the Yass method so you can resolve your pain, get in touch with me. Let's use the Yass method. Let's resolve your pain. Let's end chronic pain. Let's return people back to their full functional capacity. This is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye.